Good morning, everyone. So this is your video to talk you through plant-based medicines, which starts on page 238 of your textbook. I'm going to ask you guys to submit a copy of your notes in whatever form to me. So I would recommend making your notes as you go through this in order to save time. I'm going to do it as a mind map because you know I love a mind map. If you guys want to do it as a mind map as well, then that's absolutely fine. If you do it online, then MindMap, as you know, is a great website. Please screenshot it and upload that to Schoology for me. If you do it on paper, that's absolutely fine. Just take a picture and upload that. Similarly, if you don't like mind maps, you know they don't work for you, then I have no issue with you taking notes in whatever form you want, be that typing on a device as I'm talking, or if you want to do it, handwritten, it's fine. I just need either a picture or a copy of that document on Schoology. I trust you guys can figure out how to submit it properly for me. So, getting ready to start. So in the textbook, this topic is kind of lumped together in a bit of a odd fashion. So we've got bacterial growth, aseptic technique, and then plants actually versus microbes. This kind of talks about why we use medicines, I'll turn that around for you, why we use medicines from plants, what different types of substances we can get from them. So I think in order to be able to fully understand this and appreciate this, you need to have an idea about bacteria, how they reproduce, what they need, what they like. So that's where I'm going to start because that's the order that makes sense to me. So starting off with bacterial growth. So bacteria reproduce by binary fission, which essentially means they just split in half. Physicists here will recognise this word fission. It means the exact same thing. So like you might do nuclear fission, so splitting nuclei, I think, in half. We get binary fission, so it's just the splitting of bacteria. That's how they reproduce. That's their version of sexual reproduction. In ideal conditions, bacteria can divide every 20 minutes. Not necessarily all bacteria will divide at that pace, but some are definitely capable of doing so. So as you can imagine, if you've got your bacteria doubling in population size every 20 minutes, it's why a bacterial infection can be quite serious in terms of medical treatment. Ideal conditions for bacteria include an adequate food supply, adequate oxygen supply, and the correct temperature, the correct sort of warmth. Most bacteria don't like to be cold. You're not going to grow bacteria on an agar plate, in an air-conditioned cold room. We have to actually incubate them and keep them warm. Think about bacteria infecting your body. It makes sense that the ideal conditions for it would be warm sort of body temperatures. Excuse me. So, for scientific investigation, whether that is growing bacteria to check if a medicine works in destroying them, in getting rid of them, or whether that is you want to see, perhaps you're a microbiologist in a lab and you've been given a swab from a patient, you need to check what bacterial infection that patient has, we have to culture them. You have to generate them, deliberately support the bacteria to result in large numbers of the microorganisms so that you have sufficient bacteria in order to do the tests that you want to carry out. So as we said, that requires the correct level of nutrients, the correct or adequate oxygen supply, the correct temperature, and some bacteria are sensitive to pH, so it's potential you have to manage that. How we do that in a laboratory environment is through the use of agar plates. So I'm just going to quickly flick over here. So this picture is in your textbook. This is actually showing you aseptic technique, which we'll talk about in a minute, but that is what your agar plate would look like. This is what your agar plate might look like after you've actually cultured it. So you've got your plastic petri dish, you've got your agar, which is that jelly-like substance, and you're trying to grow bacteria on it. This agar is red because something's been added to it, potentially blood. You can do blood plates. So it might be that those particular bacteria require nutrients from blood, but you can add in anything you might need to your bacteria. You can add in anything to your agar that your bacteria might need in order to survive. So there's particular nutrients, for example. Okay, so that's what our agar looks like, what our agar plate might be. And as I said, microbiologists might have several different of these. They might have them at slightly different temperatures and within a range. And you can use different agar plates to determine what type of bacteria it is. If you haven't got a clue, then you might add it to one bacteria that has a certain nutrient and one agar that doesn't have that nutrient, and it might help you identify what the bacteria is. So that's our little bit about bacterial growth. I'm now going to move on to aseptic technique. Now, aseptic technique, this is your definition straight out of your textbook. It's your definition to have in your head in case you're asked about it. is a method of carrying out a procedure to prevent contamination by unwanted organisms. So if you imagine trying to culture your bacteria in those agar plates, you want to make sure that on your agar is only your bacteria, so you need to carry out aseptic technique to make that actually happen. It's important for a whole host of reasons. First of one is you might be trying to culture a completely harmless bacteria, so one that doesn't cause any disease, any condition, in humans, animals or plants. So, it's not a danger in any way, shape or form. However, there is always a chance of a mutant strain arising during the course of your investigation, and that mutant strain could be pathogenic, disease causing. So if you don't use aseptic technique, then there's a chance that you're going to spread that mutant pathogenic strain around the lab, the different people. It might get out into the wider community, and it's obviously going to be an issue. Sort of the flip side of that is there is a risk of contamination by pathogenic microorganisms from the environment. So again, your particular plate might not contain a bacteria that is harmful at all. It could be a completely non-harmless bacteria, but if you don't use aseptic technique, you could contaminate your work with something that is pathogenic, and that could lead to obvious consequences. Also, when you are growing or culturing bacteria in the lab, you want a pure strain. On your plate, you want only the bacteria you're interested in. Think of it like a control variable. If you've got other bacteria in there, how could you possibly interpret your results? You can't say, oh, this antibiotic or this antimicrobial works, because you've got other bacteria in there. So the entry of other microorganisms from the air or the skin into the culture will contaminate it. So a bacteria from you or bacteria that's just present in the air in the lab could contaminate your plate and ruin, all of your work. So that's why we have to use aseptic technique. Things that count or come under the sort of label of aseptic technique is all of your equipment must be sterile, so free from living microorganisms and their spores from the very beginning. This includes flaming the inoculating instrument in a Bunsen burner. So if I quickly show you back to this picture, I've also got a video link about aseptic technique. If what I'm saying to you doesn't quite make sense, or you would like to see it sort of more hands-on, then please watch that video link. But in terms of our diagrams that we can talk through here, so you would have an inoculating loop. So this is the loop that you would dip into your bacteria to then spread out over your agar plate, as you can see in the next picture. So flaming it means holding it in a lit Bunsen burner. So you're getting rid of any bacteria, any microorganisms, any contaminants from that flame. So doing that, flaming it, is part of aseptic technique. Microbiologists will often also leave a Bunsen burner on a yellow flame when next to them in their working area, and that creates a convection current. And so that convection current takes any airborne microbes that there might be away from your plate, so they're not going to land on your cultures and contaminate them. Obviously, the culture must not leave the lab, so it needs to stay in that particular defined area so that you're not exposing, sort of the outside world to it. And when it comes to getting rid of the cultures, obviously once you've carried out your investigation, you've determined if an antibiotic works, or you've determined what the bacteria is for your patient, you're not going to keep those cultures around for the rest of the time. You need to dispose of them. And how we do that is using a piece of equipment called an autoclave. And essentially, you seal them into a plastic bag and it sterilises them by exposing them to really high temperatures and high pressures for about 15 minutes. And then they can just be got rid of with the typical normal medical waste. So that's about aseptic technique. And then lastly, we've got plants versus microbes. So plants can provide an ideal place for microorganisms to grow. If you're a plant, you are the food source. As long as you're in a suitable environment, there's going to be enough oxygen and you're going to provide some sort of warmth temperature for them that is correct. So because they are this ideal place for microorganisms such as bacteria or even fungi to grow, they will naturally produce chemical defences to kill any microbes in order to keep them alive. And over the years, we've been able to sort of use this to our advantage. So types of substances that plants might produce are antiseptic compounds, antibiotics, or antimicrobials, and these are chemicals that kill bacteria and fungi. When we're testing, I've got it under antimicrobials, but reality is if you wanted to test any of these to see if they worked on a particular bacteria, so you can determine whether to use it as an actual medicine, excuse me, you would grow this agar culture that we've been speaking about, and you would add little tiny discs of filter paper soaked in the plant extract. You might have done something similar to this at GCSE potentially. I've definitely seen GCSE questions where you've been asked to interpret it. So you get those little filter discs that are soaked in whatever you're interested in, antimicrobial for example, and you place them on your agar plates. And if they work, you get this zone of inhibition. So an area around your filter paper where there is no bacterial growth because the chemical substance has killed them off. So that would be how you would test them, and that's why agar cultures are really, really important in terms of deriving medicines from plants. So some examples of things that we've taken from them that you might know about. Pain relief. So salicylic acid is actually originally derived from willow bark. So a long sort of time before there's any sort of formal medicine, people might chew on the bark of a willow tree as a pain reliever because it contained this compound, and that was released and it helped them. Malaria can be treated with quinine, and that's actually come from this particular type of tree. Syncora, I believe it's pronounced, but please correct me. So people, perhaps more remote cultures, more remote settlements or civilizations might use these more natural remedies because they don't have access to modern medicine. Okay. However, typically, you now, if you want pain relief, you go and get an aspirin from the pharmacy, or a paracetamol. You don't go and chew on a willow bark, and that's because we now work to extract and purify the drugs found in plants. They may ask you in an exam, why is this an advantage? Why is it advantageous to extract it and purify it in the lab as opposed to just handing out the actual plant itself? And there's a couple of reasons. First reason of which is you can give a known repeatable dose of the active ingredient. So I can give you a tablet and say, okay, this contains 15 milligrams of salicylic acid, for example. That number isn't exactly correct, but you can give a specific dose, and you can say to your patient, take one of these 4 times a day at this time. Whereas if you were giving them just a piece of willow bark and saying, chew on that, the levels of the chemicals in a plant can vary with the age of the plant or the season of the year that we are particularly in. It is not controlled, it's not repeatable. You cannot know how much of that active ingredient, that ingredient that is your painkiller or whatever it might be, you cannot know how much of that you are giving to your patient. So obviously that puts us in a position of it being slightly more dangerous. So that's your one advantage, you've given no repeatable dose. Your second advantage is doing it this way, you can reduce the amount of plant material needed. So we're not pulling up trees, chopping down trees, pulling up plants in order to get medicine. What actually happens is when it's first discovered, or we first identify and we think something could be useful, is scientists work on isolating those chemicals, analysing its chemical structure, and then trying to synthesize it on an industrial scale. So they might say, okay, the chemical structure of salicylic acid is this. We can now go away and make it for ourselves. And you could also even add things to it to make it more effective. So in doing it this way, and you're extracting and purifying, you can help to reduce the amount of plant material needed, which is obviously better in terms of an environmental advantage. Okay, so that was plant versus microbes, aseptic technique, and bacterial growth. As I said, I'm going to need a copy of your notes in whatever form, so please take a picture. If you've done it sort of in a book, if you've done it as a document on your computer, upload that. If you've done a mind map, please take a screenshot and upload it to me. Any questions, post them in the Schoology discussion. I'm more than happy to answer them. And as soon as you're ready, please move on to your next task.